Having been on the course and Deepa's teaching us about the types of composite, essentially there are, broadly speaking, 3 different types of composite. There are microfill composites, there are hybrid composites, and there are true nano-filled composites. Micro-filled composites are not as strong in terms of, from a tensile strength point of view, and are much more prone to fracture. But the advantage that they have is that they are much more polishable. They tend to hold that polish for longer. Their handling characteristics tend to be much nicer to use. And they can give a really nice, long-lasting aesthetic result. The hybrid composites are stronger, so they're more suitable for kind of lower incisors, palatal aspects of upper incisors, posterior teeth. But what you gain in strength and kind of fracture resistance, you lose in terms of aesthetics, so they're not as polishable. Even if you polish them to a really, really high standard, you spend a lot of time in surgery doing that, they will gradually dull over time, unlike a microfill. With the Renamel system, having both, so you have kind of the nano hybrid composites, you have the micro hybrid composites, as well as the true microfill composite. The beauty is you have a toolkit there with a few different types of composite that you can use in different situations. They're all the same shade system. So you have an A1 microhybrid, an A1 nanohybrid, and an A1 microfill. And you know that if you're doing, for example, a class 4 restoration, and you've decided that you can do it in shade A1, for your palatal shelf, you can use A1 microhybrid or nanohybrid for the strength. You can put A1 microfill over the labial aspect. And all of a sudden, by combining the 2 different types of composite, you get the best of both worlds. You get it strong enough that it's not going to be pinging off every 6 months and the patient coming back to see you, but you also get that polishability from the microfill, and you get that long-lasting shine. So when you see the patient for their 6-month checkup, their 12-month checkup, they don't have that kind of that dimming, that dulling, and kind of, they still look good when they come in. And I've surprised myself. I've been using the system for about 9 months now, and my patients come back, and I expect to maybe have to give these restorations a little bit of a polish, and I have the polishers out ready for, I see the patient in the waiting room, ask my nurse, get the polishers out, we'll give these a bit of a buff for so-and-so when they come in. And they come in and they sit down, and it just doesn't need it, and it's great. It's nice to have the confidence to know that by using both these different types of composite in the right way, I'm producing restorations for my patients that are going to look lovely as they walk out of the chair, but they're also going to look lovely 6 months, 12 months down the line, which is exactly what we want. And yeah, it's not all kind of the showbiz before and after photo. We want our patients to be happy as well at the end of the day, and having that long-lasting result, especially when they spent a lot of money on it, is an important part of that.